Thank you very much, Mr. Speaker, honorable members. In 2025, after completing a very successful term, we went to the electorate to get our mandate renewed. We did not go to them with a broken record. We did not go to them with empty promises. We went to them, we went to the Guyanese people with a track record of accomplishments. Some of those fulfill the immediate needs of the Guyanese people, while others lay the foundation for a transformation of our country. On the 1st of September 2025, the people of Guyana made their choice, which was the overwhelming choice for the President of this country, Dr. Mohamed Irfan Ali, and the People's Progressive Party. The people, Mr. Speaker, the people of Region 4 also made a choice because of the PPP's vision, leadership, and transformation. For the first time, the people of Region 4 voted solidly for the People's Progressive Party. Mr. Speaker, we want to thank the people of Region 4 for making such a choice. And we want to thank all of Guyana for choosing President Ali and the People's Progressive Party to lead this country in a new era of prosperity. Mr. Speaker, in the lead-up to the elections, we unveiled to the Guyanese people a manifesto, a blueprint for the next 5 years. This budget, Mr. Speaker, this budget 2026 is the first installment to implement the policies and initiatives outlined in our manifesto. I want to commend Dr. Ashley Singh and his team for presenting a budget that unifies rather than divides, a budget that does not discriminate, does not exclude, and does not hesitate to put the people of Guyana first. It is a budget grounded in fairness, guided by compassion, and anchored in the simple but powerful belief that every single Guyanese matters. Mr. Speaker, with the elections, there were also some new configurations in the opposition benches. And we can categorize them as less, lesser, and the least. And they know themselves. There are some new faces over there, but the practice is the same tired politics. Divisive, backward looking, and utterly bankrupt of ideas. Little wonder that they are the less and the lesser and the least. Mr. Speaker, the APNU Win opposition has said that this budget has nothing for people. We never said that. But let's check the facts. What do we have for the young people of this country? What do we have for the old people of this country? What do we have for the adults of this country? Let me start so that you will hear. Let's start by putting babies first. Antenatal care for mothers. 14,000 mothers benefit annually from antenatal care. And I heard the honorable member who spoke before me was talking about expectant mothers not having proper care in the hinterland. Well, you know, the honorable member is probably very anchored in Linden, and he doesn't know what is happening in the rest of the country. But if he had taken a chance to go out, he would have known that over the last couple of years, under this PPPC government, that we have built 11 waiting homes. What is a waiting home? What is a waiting home? When you want to get a baby, you don't have to wait until you go into labor and then try to get to the hospital. What you do is that you go there before and you wait, and when you go into labor, we move you across so that you can deliver safely at our hospitals. Right now, as we speak, we have 100 beds in 11 waiting homes in regions 1, 7, 8, 9, and counting. Mr. Speaker, on babies, we have started the baby grant. Every baby born now, they will get $100,000. And I know the member said he's very concerned about what is happening in the interior. But every mother in the interior that gave birth at one of our facilities also would get a postnatal hamper, which consists of care products both for the mother and babies. And every year, over the last couple of years, we have been distributing close to 3,000 postnatal hampers to our mothers. Mr. Speaker, when a child goes to the health center, they can access more than 18 different antigens of different types of vaccines that protect them from childhood intervention. That, my friend, is good preventative practice. Mr. Speaker, let's move from the babies now. Let us go to children. So, when a child starts nursery school, Mr. Speaker, we are able to screen that child so that we can check if they are hearing properly, we can check if they are seeing properly, we can do a dental checkup for them, and I should urge the member to also do part of these dental checkups in Linden. Mr. Speaker, over the last 2 years, we have checked 18,374 nursery school children. And when we screen them not only for these areas, but a general screening, If anything is wrong with them, we bring them into the public health system and we work to fix the problems that they have. And it's all free of cost. Mr. Speaker, last year we introduced the universal lab voucher, which can be used in the case of children to screen for congenital conditions such as sickle cell anemia. And since we have introduced this voucher, we have screened 13,112 children across this country. Mr. Speaker, when they grow older and they have to move from nursery into primary school, again we'll do a screening for them, a general checkup that is age appropriate, and we also do the vision, hearing, and dental checkups. So far, we have screened 55,717 children in primary schools across this country. And when they move from primary into secondary, we have started that process of screening secondary school children. And so far, we have screened 6,508 children in our secondary school. When you look at this budget, Mr. Speaker, these are the kinds of initiatives that are in this budget that our people across this country would benefit from. The children of Guyana would be benefiting from these initiatives. Yet, the friends on the other side, if I can call them friends. You're right. They come to this house, and every one of them who spoke so far got up and said they cannot support this budget because there's nothing for the people in this budget. Well, some of these things that I've told you, are these things to people? Are these some abstract number? This is real people getting real benefit from the budget and from this government. Mr. Speaker, every school child, as was said repeatedly, now gets 85,000 per annum. When they were in government, whether they were over there or some of them over there,
all the same.
they were the same up now. And we know the story. They took away the Because We Care grant and replaced it with some of these bees. And we don't have to go down that road now because we heard that with the 37 bus or 35 bus that they had, the grand number of 32 buses to transport 206,000 children across this country. You replace a universal voucher program that is helping every single child with 32 buses. But, Mr. Speaker, this government, we have replaced, we brought back the Because We Care grant, and we said we are going to increase it, and now we have increased it to 60,000, plus you're getting 20,000 transport allowance, plus another 5,000 for uniform.
David G, number 6.
Mr. Speaker, we also want to ensure that our children are not in a school where they're hungry, And so we have been providing hot meals in every school so that our children can benefit from those hot meals. Mr. Speaker, look at what we are doing for the children who want to write 𝐁𝐔𝐃𝐆𝐄 or 𝐃𝐄𝐁. This government is ensuring that if you want to do 8 subject, that you will get it paid for by this government. Whether it's 𝐁𝐔𝐃𝐆𝐄 or 𝐃𝐄𝐁, this government is paying for it. One of the problems that we have, Mr. Speaker, that is affecting women in this country is cervical cancer. And the honorable member spoke about prevention. And one of the best ways of preventing cervical cancer is to ensure that we give our children the HPV vaccine. We used to use a vaccine that was a 4-valent vaccine, meaning that it targets 4 different strains of the HPV. And last year, we switched it to a 9-valent vaccine so that we can cover more of these oncogenic strains. And last year, we were able to give 26,000 children between the ages of 9 and 15 this new HPV vaccine. And this is going to protect them from getting and developing cervical cancer. But the numbers doesn't stop there, because we also want to protect our boys from getting other HPV-related types of cancers. And so this vaccine is now available for both boys and girls 9 to 15. This is preventative medicine, Mr. Speaker. Mr. Speaker, another program that we haven't spoken much about is for teenage girls. And those teenage girls who need menstrual hygiene products can get it from the ministry. And every year we distribute to close to 15,000 young women across this country menstrual hygiene products. Mr. Speaker, children with special needs, we now would have developed new autism guidelines. We are making the diagnosis early. We have trained our doctors to be able to do that. And across government, in various ministries, we have programs so that we can help those who need that type of help. And this is some of the things that we are doing for our children. And this, by no stretch of the imagination, is an exhaustive list. That is how we are putting children first. Mr. Speaker, let's move on to the adults. Putting adults first. First of all, we would have increased the income tax threshold to $140,000 per month. And that is going to help Guyanese across this country. Mr. Speaker, we promise that we are going to give every single Guyanese 18 years and older a cash grant of $100,000. And we have budgeted, in this budget, we have put the money there. And so as soon as we pass the budget, we are going to give that cash grant again. Those on the opposition benches, they love to talk. And when they were in government, they were talking up about cash grant. But they never stepped forward to give any person in Guyana a cash grant. But this government, we don't only talk, but we deliver on everything that we talk about. And Guyanese across this country now can benefit from the 100,000 cash grant. Mr. Speaker, over the last 2 years, children between up to 18 and under, and adults 50 years and older were able to get an eye checkup because they could have gone and collected a voucher worth $2,000 and go to any private facility and get that eye checkup. How many persons benefited from this eye checkup? 175,272 persons benefited from these eye checkups. This is what putting people first means, because this is helping the people of our country. And those who check their eyes, and if they wanted a pair of spectacles, then you can come back and we'll give you another voucher worth $15,000 to help you to buy your pair of spectacles. How many people did we help? 160,288 persons benefited from this program. Tell me, isn't this putting people first? Mr. Speaker, people with hearing impairment, they too need help. But under the APNU and AFC, when they were there, I want to ask them, how many persons with hearing impairment did they help? There was a program where a company, 𝐁𝐔𝐃𝐆𝐄 Foundation, used to come to Guyana and donate hearing aid. And when that foundation stopped, the program stopped, because the APNU did not find resources to help the people who needed hearing aids. But under this government, we are not only testing your ear, we are also giving you hearing aid. And over the last couple of years, we would have given 4,091 persons. And the average cost is close to $90,000 for a pair of hearing aid. And anybody who needs, you can contact us. We'll be willing to give you. Mr. Speaker, what about dental procedures? And I'm sure the honorable member who spoke before me, but he disappeared. In the area of dental health, we were able to do last year 430,761 procedures. And among them, we did fillings, we did surgery, we did root canal, we did x-rays for people who needed x-rays. We can do CT scans for those who need it. And we have introduced something called digital dentistry. And I wanted the honorable member to be here so that I can tell him some of the things that we are doing in dentistry. We have been able now, Mr. Speaker, at the Chadijagan Dental School, We can now do 3D printing of bridges. And when people needed a crown, most times they'll do an imprint, and you have to send that to Miami, and it takes about 2 weeks before you can get a crown made. And sometimes when you bring it, it don't fit well. But now we have a 3D printer at the 𝐁𝐔𝐃𝐆𝐄 Dental School, where it can take maybe within an hour, and you can get a brand new crown, so you don't have to send it and wait 2 weeks. This is what putting people first looks like. And when in the whole dental sector we did not have a single CT scan, we now have more than 5 across the country so that people can get help. And in Linden, we have improved the dental services there so that the people of Linden can get the benefits. But you know, Mr. Speaker, we heard how some people are getting burned out. And I'm wondering whether the honorable member is one of those persons. Because in the last month, when he's supposed to be at the clinic, he only saw 17 patients for the month. And I don't know if seeing less than 1 or 2 patients a day would be tantamount to burnout. I hope that he would improve seeing the patients of Linden so that they can get the service for what these taxpayers of this country is paying for. Mr. Speaker, putting women first. Mr. Speaker, as I said, cervical cancer is the #2 cancer among women. And we started a program to ensure that women between 21 and 55 years can be screened. And so far, in over 2 years of this program, we would have screened 20,853 women. And any one of them who tested positive can come in and we'll be able to treat them so that it doesn't have to move from being infected to developing cervical cancer. This is how this government is caring for people. Putting people first. Putting the women first. Mr. Speaker, breast cancer is #1 among women in this country. And we didn't have mammography to be able to diagnose women with breast cancer. But now, the people of Linden, they have a mammography machine, and they can go there and get their diagnosis right at the Linden Hospital complex. You can go to New Amsterdam now, and you can get your mammography there for free. You can go to Saudi Hospital, and you'll be able to get your mammography there for the people on the Essequibo coast. And Mr. Speaker, you can go to Latham, at the Latham Regional Hospital, and do your mammography there. This is what equity looks like. We don't come and talk theory. We are here practicing it every single day. So far, more than 10,000 women would have benefited from mammographies that we are doing across this country. And if when we diagnose you using the mammogram, we can also use the new pathology lab that we have to do a differential so that we can treat you appropriately. You don't have to send the test abroad now. And back in those days, it would have cost someone close to $150,000 just to send a test to know what type of breast cancer you have. Mr. Speaker, what about family planning? Women who want to do family planning, we are now able to offer them contraceptives of their choice. And over the last year, we would have assisted 18,443 women across this country. This is how we are putting women first. What about the men? Putting men first. Mr. Speaker, prostate cancer is the #1 cancer among men in Guyana. And the big challenge is that we weren't diagnosing it early. So one of the things that we have introduced about 2 years ago is to make sure we make PSAs widely available to men. And so far, 36,465 men did their PSAs. And if it's elevated, then we'll be able to decide whether you need a biopsy. And so far, we did 1,302 biopsies for the men of this country. And of those, 712 of them were positive. So we find them early, and they're all in treatment now. I know you're an advocate for that. Mr. Speaker, on average, a biopsy would cost about $150,000 Guyana dollars. And men now can access it free of cost from the healthcare system. Mr. Speaker, putting our patients first. Right now, Mr. Speaker, across our system, we have about 32,966 persons at our hypertensive clinic. And they are now all benefiting from a program that we started with PAHO and WHO. It's called the HEARTS Protocol, where we are able to give them more effective medication so that we can control their blood pressure. We also have about 21,000 persons who are registered in our diabetic clinics. And in partnership with Mount Sinai, we have been able to do new guidelines so that we can have better control with these patients.
Honorable Minister, your 5 minutes extension starts now.
Mr. Speaker, there are lots more that I want to say, but you know what? I'll skip it. And I just want to say something. They talk about equity. 25, we graduated 2,207 persons, nurses, midwives, and many more. And this year, 2026, we have 2,847 persons who would also be graduating. Among them, 1,800 registered nurses, so that they'll go to the hospitals that we are building, and they would ensure that we have better services. Mr. Speaker, the University of Guyana has also expanded its training program, moving from an intake of 60 doctors to 120 doctors. And at all our regional hospitals, we will now be expanding the services and we'll be doing first and second year clinical programs in a decentralized way. We also have many programs where we are training doctors in postgraduate training. And Mr. Speaker, this is just a sample of some of the things that we are doing. But Mr. Speaker, we don't have to come here to convince anybody. The people of this country, they know fully well what they are enjoying. And when we said that we'll build a world-class healthcare system, it's not just rhetoric. We are doing it every day so that the people of this country can enjoy the best healthcare possible. This is putting people first. Thank you, Mr. Speaker.